my name is Phylana, and I'm going to be your student nurse today. I'm going to be completing a head-to-toe assessment. This is my instructor, Melissa, and she'll be watching as I complete the assessment. Is that okay with you?
Yeah, that's fine.
Okay. So I'm going to start off by letting my instructor know that I have completed privacy, I've closed the curtains, and I'm just done washing my hands. I have my hand sanitizer here. And I'm just going to ask you a couple questions first. Is that okay?
Yeah, no problem.
Okay. And do you know your name?
It's Danny, Phylana,
Do you know where you are?
in the hospital.
Do you know what season it is? Or what date it is today?
The 23rd of September,
Year.
2020.
Okay. And do you know why you have been admitted to the hospital today?
Because of my gout.
Because of your gout? Okay. So the first thing I'm going to do before I start your head-to-toe assessment is confirm that I do have the right patient. So I'm going to ask you to state your name once more
Danny Phylana,
and your date of birth.
03/06/1996.
Okay, awesome. So my patient is alert and oriented ×4. And before I begin, I'm going to make sure my bed is raised to a comfortable level, so I'm not injuring my back or anything before I begin. So firstly, I'm going to be looking at your head and your scalp, and I'm going to be making sure there's no bumps or any abrasions noticeable or any head lice, and there is no signs of any abrasions. And next I will be looking and feeling your neck, making sure no lymph nodes have been inflamed and that all the neck bones are symmetrical. Okay. And then I'm also going to be looking, using my pen light, I'll be looking in my patient's ears, and I'll be checking to see if there's any drainage or any discoloration or any gunk that might be in there. Just going to turn your head a little bit. And I'm just going to look. And then look the other way. And when checking the ears, I'm also checking for any masses or abrasions that may be behind the ear. Also, I'm going to ask the patient, do you hear any ringing in your ears?
No.
And I'm going to repeat something to you. I'm going to whisper something to you, and I want you to repeat it back to me out loud. And I just want to see if your hearing is okay.
I like chocolate.
Okay, and you have good hearing. And then I will be checking inside his nose. So I'm checking for any excess drainage or also any lesions or abrasions that may be up there. I'm also looking at the septum. I'm making sure it is symmetrical. If it is to one side more than the other, it can cause the patient to have any difficulty breathing. And now I will be assessing the patient's mouth. So just open wide and say ah. For the patient's mouth, I'm looking for any soreness, redness, any open wounds, canker sores, bleeding on his gums. And now I will be asking if you have any pains in your shoulders.
No.
How about in your arms?
No.
bottom of your arms?
No.
No? Okay. Alright. And can you lift your head up off the pillow for me? Good. And then can you look right? And can you look left? And can you lift your arms? Then go ahead and put them back down. Can you wiggle your fingers? Awesome. And then I will be checking the cap refill on your fingers. Comes back almost instantly. Alright. And now I'll be moving down to the heart area. So I will be using my stethoscope. And I will be listening to the apical mitral sound for heart sound for 1 minute. I completely forgot my watch again. Okay, this is imaginary watch.
My watch is over there on this one.
Okay, so I have my watch, and I'm going to be listening once again, to the apical mitral for a whole minute with the bell of my stethoscope. And usually the patient would be, I would go under the patient, skin contact, but my patient isn't comfortable with taking his sweater off. So, right, and I'm going to time my minute. Alright, so the heart sounds are regular. Okay, and then I'm going to have you sit up for me so I can assess your lung sounds. Just move this a little bit. Okay. So I'm going to listen to the lung sounds, firstly in the front, and then I'm going to move on to the back. And I'm listening from the right lower quadrant to the right upper quadrant to the left upper quadrant and to the lower left quadrant. I'm sorry, first I'm gonna do my lungs and then my abdomen. I got ahead, I'm sorry. So go ahead and take a deep breath for me. And again, normally I would do on the skin contact, but not in this case scenario. And what I'm listening for is any wheezing or crackles that may be happening within his lungs. listen to the back. Oh, it's fine. Deep breaths for me. Deep breath. Okay, go ahead and lay back down. Okay, and now I will be, sorry, can't hear with these. Now I will be listening to his abdomen. So I will look and inspect the abdomen. I will make sure there's no discoloration of any color on the skin or any masses that might be appearing, or any swelling, inflammation that might be in this area. So as I said earlier, I'll be listening, looking, and then palpating. So I would be listening from the right lower quadrant to the right upper, to the left upper, to the lower left quadrant. Just listening for any movement, any gurgling that might be causing any blockage. And have you had any problems going to the bathroom?
No.
And when was your last bowel movement?
About an hour and a half ago.
Okay. And was the consistency normal? What was the color?
It was normal color, brown, solid.
And when was the last time that you ate?
About 2 hours ago.
Okay. And do you have any problem urinating?
No.
Is there any blood in your urine?
No.
Do you have any odor to your urine?
No.
Okay. All right. So now I'm going to move down to the legs. So just a little bit. Let's see. Okay. So legs, I will be making sure that the range of motions are okay. So I'm going to lift your leg, see if you can bend okay. Lift this one, okay. And then I will also be checking the popliteal pulse, which is under the knee, just to see if I have any reactions. Okay, and then feet. I'm gonna be pushing your foot back, okay? So just see if it can bend okay and push forward, back. And I'm also going to assess your cap refill at the bottom of your feet. Come back instantly, looks good. And then I'm also going to be feeling your ankles, and I'm making sure that they're equal. No swelling, no redness. Okay. And then I would also check the back of the patient, make sure there's no redness, abrasions, or swelling. Check his buttocks and make sure there's no infections. And then I would make sure my patient has access to a call light. And I'm all done.